of any description. Okay, I think we are live. So, hello everyone. Great to have you on the show. This is This Week in Global Health, or TWIG for short. TWIG is a once-a-week global health news roundup. It's a live show, so you can interact with us. You can interact with us on Twitter. You can send us a question, for example. Just use the hashtag TWIGH. That's This Week in Global Health, that's right. Or you can comment in the comment box below this if you're watching it on YouTube. Keep in mind, if you're not watching this live, it means you're watching this on YouTube at some point in the future. You can still make comments under the video, and we'll try to respond to those whenever we can. Right. This week, we're going to be talking about the Ebola virus epidemic. That's really current. It's happening. There's so much news and developments, etc., etc. Before we carry on, I'm going to ask the members of the panel to introduce themselves, to tell us a little bit about who they are, where they're from, and what they're going to be talking about. I'll start with myself. My name's Greg Martin. I'm going to be giving you a little bit of facts and figures about the Ebola virus in general. Let's move on. Jessica, talk to us. Who are you? What are you going to tell us about?
Hey everyone, I'm Jessica Chaff. I'm a biomedical scientist and global health consultant, and I'm coming to you today from the Washington, D.C. metro area. Today I'm going to be giving you an update on the vaccines, drugs, and therapeutics that are going on with this epidemic right now.
Okay, thanks very much. And next up, Christy. Christy, tell us who are you, where are you, and what are you going to be talking about tonight?
Thanks, Greg. I'm Chris Ronson. I'm coming to you from San Francisco, California. I consult in maternal and child health, and today I'm going to be doing a profile on MSF from Medicine Sans Frontiers.
Okay, and when I said what are you going to be talking about tonight, obviously it's not nighttime where you are. What's the time on your side of the world, Christy?
11:03 right now.
Okay, so what are you going to be talking to us about this morning? All right, next up,
this morning,
Vanya.
MSF will also go over jobs.
Okay, Vanya, talk to us. Where are you in the world, and what are you going to be telling us about?
Hi everyone, my name is Vanya de la Fuente, and I'll be talking about the evolution and current status of the Ebola outbreak, as well as the impact of this disease on food security in West Africa.
Okay, brilliant. And just to highlight the global nature of this show, I'm going to ask Tim. Tim, you are in an interesting part of the world, and we're delighted to have you on the show today. Tell us, who are you and where in the world are you at the moment?
Yeah, it's kind of good morning from here as well. I'm Tim France from Inish Communication, and I'm coming to you from Chiang Mai in northern Thailand, where it's 1 o'clock in the morning, so forgive any yawning.
Northern Thailand, 1 o'clock in the morning. Well, Tim, thanks for getting up at that strange hour of the night to be with us. Just a note to everybody, all of our presenters are going to present you with some information, and most of them will make references to web pages where you can find more information. And you might be thinking, where can I get the links, the URLs? How can I find those web pages? Nobody panic. You can get them. We're going to have them in the show notes, which will be beneath the video. The other thing is that in the show notes, we're going to have a link that you can click on that'll take you to a form you can fill in, which will let you subscribe to our newsletter. Our newsletter we send out once a week has all of the show notes with all of the links, etc., etc. So you can once a week get an update of, of all of the information that we presented in the previous show, and an update as to what are we going to be talking about in the next video, or in the next show, which will be in a week's time. We do it every Wednesday. Just to let you know, next week at about this time is the UN Climate Summit. And so we're going to use that opportunity to do an episode next week on climate change and health. So, stay tuned or tune in for that. That'll be fun. We're going to start tonight, or today, as the case may be, by asking Vanya to talk to us a little bit about the current Ebola virus epidemic, a little bit of the evolution. Where did this come from? Where are we at the moment? Vanya, over to you.
So that's right. So researchers believe that the first human case of the Ebola virus disease leading to the outbreak appeared in Guinea in December. However, it was not until March 2014 that the Ministry of Health of this country actually reported the outbreak of Ebola virus disease. By the end of August 2014, the disease had spread to Liberia, Sierra Leone, Nigeria, and Senegal. 35 people have also died from a separate Ebola outbreak in the Democratic Republic of Congo. The outbreak in this country stems from a different strain from the one raging in West Africa. The Congo outbreak, in contrast to the West Africa outbreak, is confined to 4 villages in one country and is linked to one initial case first reported on August 26th.
Okay, thanks very much. And I think maybe what's just in terms of the sort of timeline that we're talking about, it's quite interesting. I mean, it seems that the index case was in December last year. In about February, March this year, we were really talking about this being an epidemic, but it was only in August this year that this thing was declared a health emergency of global concern by the WHO. So I think there's been a lot of concern about the lag in terms of the global response to this epidemic, and we've really landed up in a mess at the moment, and things are we don't even need to talk about how bad things are. We're going to talk about that in a minute. I'm just going to talk a little bit about Ebola virus disease. I'm not going to go into too much detail because anybody watching the show, if you're interested, you're going to know a lot about it already. Importantly, perhaps worth pointing out is that the incubation period for the Ebola virus disease is 2 to 21 days. That means there's 3 weeks, potentially 3 weeks, that a person could be moving around from one place to the other, during which they're asymptomatic. While they're asymptomatic, they're also not infectious. So they're not passing the disease on during that period of time. And as soon as they become symptomatic, they also become infectious. The early symptoms of the Ebola virus disease are things like a headache, fever, sore throat, weakness, etc., etc. So it could mimic a simple flu, or it could mimic malaria infection, etc., etc. Later on, we get vomiting, diarrhea, organ failure, and bleeding, and these are the sort of more dramatic signs. And an important thing about, when people die of the Ebola virus disease, and the fatality rate in this particular epidemic is, I think, just over 50%. When people die, the way dead bodies are handled, so the burial ceremonies, are an important part of how this disease is spreading. So it's extremely important that people not come into contact or not make physical contact with dead bodies that have died from the Ebola virus disease.
Greg,
yes.
I was thinking it's really important to point out, because you're talking about the symptoms that aren't, like, you think about Ebola because you've seen Outbreak, or you've seen these films, and it's about bleeding through every orifice. But I think it's important to point out that that's not the majority of these cases. So hopefully that quells a little bit of the panic of, like, oh my God, these people have Ebola and they're just bleeding out everywhere. It's not. I mean, it's still very bad, but it's not as contagion like film thing going on.
That's right. Not everybody's bleeding out of their eyes. But I suppose related to that problem is, because the Ebola virus disease in its early stages can present like so many other things, with just weakness and fatigue and fevers, etc., etc. I think a lot of people who would otherwise present at hospitals with, that may have malaria or, diarrheal disease or something that isn't Ebola virus, are landing up receiving inadequate treatment because they're either afraid to come to the hospitals, or the hospitals are just sort of absolutely understaffed or overwhelmed by the Ebola virus disease. And so it'll be interesting to look at some point, and I don't think anyone's got the time to look at this at the moment, but to look at the fatalities that are related to the epidemic, but not from the Ebola virus disease itself. And I think we may find that there's more people that die from other diseases because of this epidemic than Ebola itself, although, it's early stages, and I think no one really knows what's going to happen. Something that's been talked about quite a lot, and I just thought we could just throw this into the mix here, not sort of as a scare tactic, but it's interesting, is whether or not this virus is or has the potential to be airborne. The first point that must be stressed is that the virus in this epidemic is not airborne, right? So we're not talking about an airborne disease at the moment. The transmission is through physical contact with body fluids, etc., etc. But Ebola virus disease does have the potential to become an airborne virus. And this has happened twice that we know of, or that I know of. There may be other incidences as well. In 1989, in a place called Reston, there were some lab animals, and there was a variation of the virus, a mutation, which caused it to be airborne. And we saw this pop up again in 2008 in the Philippines. There were 5 farm workers on a pig farm that got this Reston variation of the Ebola virus disease. Now, what's quite important is that the mutation that caused the virus to become airborne also, coincidentally, from what I can tell, made it less virulent. In other words, there's never been a fatality from an airborne variation of the Ebola virus disease. So that might just be fortuitous. And again, just to stress, this particular virus that we're dealing with at the moment is not an airborne variant. It's just an interesting fact that this kind of virus does have the potential to be an airborne virus, and perhaps for future epidemics, we need to be jumping on these things early.
Well, Greg, if it, don't mind me again, sorry to pipe in again, as maybe our resident virologist here, a microbiologist, I just want to say that just because it can, scientifically these things are possible, because the virus is an RNA virus, it can mutate, and these mistakes happen very quickly. But the likelihood of it jumping from its normal way of transmission, which is attaching to endothelial cells, to be then attaching to respiratory, that
point. Okay, why don't I say what I think she was trying to say, and when she gets on, she can correct me or add to that. And in the meantime, you guys can get your lower thirds back up and running, and that sort of thing. So I think what Jessica was saying, and I see she's popping back in at the moment, is that it's unlikely for the way the essential way that this virus is spread to dramatically change in the course of a single epidemic. So in other words, we're very unlikely to see a virus that is spread the way that it is at the moment through contact with secretions, etc., to change to a kind of an airborne virus which spreads in a very different way during the course of this epidemic. What's possibly more likely, so a more likely scenario in terms of mutations, etc., is for there to be selective pressure on the virus so that those strains, as they spread, which are more virulent, which spread more easily, to become the sort of more predominant strain in spreading across the population. And so this could be an epidemic which becomes more and more difficult to contain with time. Not a big jump, so we're not talking about something jumping from the way it spreads at the moment to airborne, but we're just talking about a more virulent strain being selected for as the epidemic unfolds. And we've never seen an Ebola virus epidemic of this magnitude before, so it's difficult to even speculate as to exactly what will happen. For more information, facts and figures about the Ebola virus disease, there's a fact sheet at the WHO website, and we're going to have a link to that in the show notes connected with this episode. Vanya's going to tell us a little bit more about the status of this particular epidemic.
That's correct. So the current status of the Ebola epidemic at this moment is as follows. The death toll from the outbreak in West Africa has risen to more than 2,400 deaths, and is likely to be an underestimate, as remarked by the World Health Organization's Director General Margaret Chan. Of these casualties, approximately 1,137 have been reported in Liberia, 557 in Guinea, 524 in Sierra Leone, and 8 in Nigeria. Also, it is also important to note that Ebola has reached a high toll on health workers, as Greg just commented. So as these have acted often as first responders. So for example, Liberia alone has lost at least 3 doctors to the virus and 32 health workers. And this, so more information will be on the show notes, as Greg remarked as well.
Okay, thanks very much, Vanya. And just on the issue of healthcare workers contracting the virus, I was actually working in the hematology department at the Joburg General Hospital in 1996 when a doctor from Gabon flew to Johannesburg, was treated in Johannesburg. He had the Ebola virus, and he actually transmitted the virus to one of the nursing staff in the hospital that he was working in, and her name was Marilyn Lahana, and she ended up dying, and she was being treated by the unit that I was working in at the time. And it also turns out, coincidentally, I found out the other day that her husband was a childhood friend of my father's. So it's kind of a small world. And that was the first incidence in the world of the Ebola virus being in a metropolitan city kind of environment, spreading from one person to the other. So the kind of scare of a big epidemic really, we were alerted to the fact right back then in 1996 with Marilyn Lahana. Okay, right, we're going to ask, what are we doing next? We're going to ask Jessica to give us an update, a science update on vaccines and drugs as they relate to the Ebola virus epidemic.
Right. So because of the dire situation with this Ebola crisis, there has been a green light on testing out experimental drugs and vaccines, which normally wouldn't have happened in other circumstances. So there are 2 experimental vaccines that are getting tested in this epidemic, and if they haven't started already, they will be by the end of this month, and they're getting tested out by UK, US, and Canadian groups. Both of these vaccines use virus vectors platforms, and they've been shown to be effective and protective in monkeys. There are also 2 experimental drugs that are getting tested in this epidemic as well. ZMapp is one of them, which is a cocktail of monoclonal antibodies against Ebola, and this has been given to 4 patients, and 2 of them have survived the infection. There's another drug, TKM Ebola, and this is a drug that interferes with the virus's ability to replicate. Now, another really promising therapeutic that I think that is getting tested out is the use of convalescent serum or whole blood transfusions from people that have survived the infection already. This is getting tested out, and I think this is really a great strategy because so many people are getting infected, and actually there are a good number of people that do survive this infection. So if you think about if it works, we could have a good stock of treatment that could treat people.
Right, that would be amazing. Yeah, very, very exciting stuff. Okay, thanks very much, Jessica. We're going back to Vanya. Vanya, can you tell us a little bit about the impact of the Ebola virus epidemic on food security? I think that's quite an interesting angle that most people haven't thought about.
Yes, I can. So recently, Thomson Reuters released a press release commenting that the Ebola also threatens food security in West Africa. This is because migratory restrictions and the establishment of quarantine zones to contain the spread of this disease have led to panic buying, food shortages, and price hikes. As a result, people either cannot afford to buy food or it is not accessible anymore. So just to give an example, the price of cassava in Liberia rose by 150% in the first weeks of August.
Okay, and I think what's interesting about when we talk about food security, keep in mind that there's so many people that live in these poor countries for whom a small shift in the availability of food really translates into dire circumstances. So that they spend a huge percentage of their income on food. A small change in price or a small change in availability of food literally turns into like people in the family starving to death. So I think that it's really important to highlight the importance of that kind of a problem as it pertains to an epidemic like this. Next, I'm going to ask.
If I could, Greg,
jump in there, Tim.
There's just a good point. This point about food security, it really kind of highlights the vulnerability of the communities and the countries where this epidemic is happening. And people might be surprised when they hear numbers bandied around saying the amount of money that's required internationally to respond to the epidemic. But a lot of resources are required to. You've already mentioned the kind of the impact this could have, the indirect impact this can have on local health systems. But this is creating a number of different kinds of needs in the countries, which is why the kind of the price tag of the epidemic is just going up and up. So it's not just a question of supplying drugs or protective clothing for health workers and things like that. And this really speaks to the adequacy or the inadequacy of the international response. This is kind of the need is getting bigger with each passing week almost. And while the attention was drawn to the epidemic largely in the West because of the threat of transmission elsewhere. And I remember right at the beginning when we talked about Ebola, everyone was worried about could this be transmitted by an airplane passenger and stuff like this. That was why it garnered a lot of attention. Now we're really talking about how do we address a kind of a vulnerability in these countries which has been created by kind of decades of neglect. This is really, this virus and this epidemic has identified a kind of fractures in those societies and taken advantage of that weakness locally. So food security is a big part of that.
And Tim, while we're talking about the price tag connected with responding to this epidemic, before the show started, you were talking about, there's been now an estimate that there is a need for at least $1 billion to respond adequately to this. Can you just maybe speak to that a little bit?
Yeah, well, at the beginning of September, WHO came out with a roadmap for responding to Ebola, which was really focused on the kind of more clinical aspects and dealing with the health-related aspects. But yesterday, the executive director of OCHA, who's the kind of more overall humanitarian UN agency, increased the budget that was required. The WHO roadmap said it needed $600 million to get this epidemic under control. And now OCHA is saying overall the response is going to require about $1 billion.
$1 billion. And I mean, we've seen like the US have now, in the last couple of days, we've seen like talking about a huge contribution coming from the US and 3,000 troops and 1,700 new hospitals. Is that contributing to the billion, or is that a different number?
Well, it's very difficult to equate the two because there is resources which are needed as cash or as materials and kind of physical resources. And then there's a contribution that these 3,000 troops will make, for example, to rebuilding 170 hospitals. It's very difficult to put a price tag on some of these things. Like China have just donated a mobile laboratory and 60 or so health workers to man that laboratory. How do you put a price tag on that? So overall, I think the $1 billion is the big umbrella figure, and these are all contributions. But I think things like the 3,000 troops, I don't think you can equate that financially. It's all really great, and I think what we saw from Obama, the announcement in Atlanta yesterday or the day before yesterday, my time, was really great. But we actually need many more responses like that internationally. When we've got, someone like the Bill and Melinda Gates Foundation giving more money to this response than some big countries, industrialized countries, there's something wrong, and I think other nations need to step up in the way that the US has done.
I agree completely. And I mean, along these lines, I mean, interestingly, in sort of May last year, the budget for 2014, the WHO budget to respond to emergency situations was actually cut in half. And one wonders if that, so we've seen the WHO in terms of the resources it's had, and the WHO really, without question, is the right organization to coordinate a global response to an epidemic like this. And if for their budget to have been cut in half at, this all of this expenditure may have been much less if the WHO was in a stronger position to respond to this whole thing much earlier. I mean, every dollar spent, early in the epidemic is better than $1,000 being spent late on. And I think that the take-home message for the international community is really, you need to jump on these things really early and be extremely aggressive, because once it gets out of control like it has now, the costs just spiral.
Wait, Greg, I want to say, since you were just talking about the economic and all the money issues associated with it, I just want to put people on the lookout. The World Bank's supposed to come up with an estimate and projections of what the economic impact of this epidemic is going to be on the West African region, but also on Africa in general. And so that's supposed to come out this week. I've been looking for it, and I don't think it came out today yet, but be on the lookout, because they're going to give you some numbers.
Right, and if we get that information, we'll include it in the show notes, so we'll have a link to that if we can find it. But I mean, suffice to say, the number is going to be formidable. And as this epidemic unfolds, we keep getting a sense that it's worse than we thought a week before. Like, every time I open my eyes, people are saying, "Well, we thought it was bad. It's actually worse." And so, whatever economic forecast they come up with now, even that may turn out to be conservative. Anyway, moving right along, one of the organizations throughout, since Ebola virus was first identified in 1976 until now, an organization that's always been on the forefront of fighting this epidemic has been MSF. And so we want to profile MSF, give them a little shout out. We love you guys. Christy, can you tell us a little bit about MSF, what they do, who they are, and we just want to talk about them for a second.
Absolutely. As Greg mentioned, we are going to be highlighting MSF, for Medicines Sans Frontières, also known as Doctors Without Borders, today, because they've been so important and integral in the Ebola response, both now and in the past. MSF began back in Paris, France in 1971 as a small team of physicians and journalists, and they've since expanded internationally, working in over 70 countries as a network of 24 independent associations. They're a non-profit, self-governed medical humanitarian organization that delivers emergency aid to people affected by armed conflict, epidemics, natural disasters, and restricted access to healthcare or exclusion from basic healthcare. To date, they've treated over 100 million people, and their mission continues as they were one of the first groups to respond to the ongoing Ebola epidemic. We've given you some facts and some timelines so far this show, and just to sort of elucidate on those further and give you some background into MSF's involvement, they were actually one of the first teams on the ground back in March when Ebola was identified in South Guinea. And that was back when... It doesn't surprise
me that they were there on the ground.
Absolutely. There were only 6 confirmed cases, and at that point the death toll was stuck at 29, which is just exponentially higher now. They're now currently responding to the outbreaks in Liberia, Nigeria, Sierra Leone, the one from the second strain of Ebola that is taking the DRC, and continuing to contain the epidemic in Guinea. Recently, International MSF President Joanne Liu spoke at the UN Special Briefing on Ebola, addressing not just the damage of the virus itself, its continued spread, lack of resources and medical personnel, but also many of the things that everyone has mentioned thus far: the overtaxed and failing healthcare systems, the infrastructure that is failing not just the society in general, but people with lesser diseases, or not lesser diseases, I'm sorry, people with more treatable conditions, people who should be getting basic healthcare, and now they don't have the means or the resources to get treatment for non-Ebola diseases. So we're we can have all the show notes, or I'm sorry, we'll have the entire full text of President Liu's briefing available in our show notes. And then later on in the show, we're also going to be highlighting MSF as part of our jobs section.
Okay, so Christy is going to talk about jobs at MSF that you might want to apply for if you're in the job market. Just to put you into the picture, one of the reasons in each episode we try and profile and highlight different organizations is so that as a community we can get a better sense of the landscape and who all the different stakeholders are. So, if you watch these episodes week after week, hopefully with time you and we will have a better and better sense of who's out there and who's doing what.
Hey, Greg. Before we move on, can I just say, can we just have like a round of applause for MSF for what they've done? I feel like they've been crying out, and I don't know if I've seen that much, really celebrating for what they've done. I think maybe because we're all just like, how are we going to get this under control? But my goodness, I just would love to give all of them big hugs after, not in their PPA though.
Absolutely. In fact, there's a way to like actually do an applause in this thing, in this Google Effects. Let's try and figure that out. Because
MSF. MSF, we love you.
Yeah, no. Here we go. Okay, so that is for MSF. Thank you for the good work you're doing.
All of the stops today.
Okay, I don't think we've never given quite such a colorful shout out to any organization in the past. They absolutely deserve it, and people that work for MSF are incredibly committed. These guys parachute into the worst places and just get things done. So we love them. Okay, next, Jessica, you're going to talk to us about research ethics and challenges with respect to the Ebola virus disease. Talk to us.
Yeah, so I told you about these vaccines and drugs that are experimental that are going into this. So one thing you have to think about is, all right, what about if these vaccines are effective or these drugs? Do we have the supplies available to get these to these people? I mean, there's going to be significant scale up. Who do we give these to? I have to remember, these are experimental lots. They're not mass produced. So this is something that's very important to think about. People don't rely on the vaccines and drugs because we don't have that much yet. It's going to take a while to get there. Another very important issue is, okay, let's say these things work, or who are we testing? We're testing them out. Who are we giving them to? Are we going to give them to healthcare workers? Are we giving them to emergency response people? Or do we give it to the general population? In a normal situation, you would want to go about this very scientifically and do randomized trials and placebos. But can you do that? Is that really ethical? Let's just say these things do work. Can you deny this life-saving treatment to these people? But then on the other hand, do we really get scientifically credible data from it? It's very, very difficult. And another final thing I want to mention is that Ebola outbreaks don't happen all that often. This is a prime opportunity to get really good scientific data. Right. But then you have to match it with the ethics. It's very tough, and there's discussions going on about this.
It's tricky, and there's a lot happening, and we're going to follow that closely. And of course, in the show notes, we're going to include links to a couple of web pages that deal with these ethics issues that Jessica has talked about. Right, next up, Vanya. Now, Vanya's going to talk about MOOCs. Firstly, Vanya, tell us what a MOOC is, and then tell us about some MOOCs that are relevant to the Ebola virus epidemic.
Right, so MOOCs are massive open online courses, and there are currently 2 online courses that are related to today's topic. Both are on Coursera, which is one of the platforms delivering such courses, and are free, which I think is pretty important. So the first one is Epidemics, the Dynamics of Infectious Diseases, which starts September 29th, and the second one is Saving Lives Millions at a Time, Global Disease Control Policies and Programs. There are no open sessions for this last course, but watch out because they might open them soon. And if you're interested in global health related online courses, keep tuned to This Week in Global Health because we will dedicate an entire episode to this topic.
Right, that's right. We're going to do an entire episode that deals specifically with MOOCs and other free online courses that you can do if you're interested in global health. Right, now, who's going to talk about jobs at MSF? Christy's going to talk about a job, or maybe more than one, that's been advertised at MSF that relates to the Ebola virus epidemic.
Yes, just to sort of drill home how important it is to have more people on the ground and more people fighting the epidemic, there's been a call by MSF UK. MSF in general in every country in all 24 of those independent associations that I talked about recruit both medical and non-medical staff in their offices, their headquarters in Geneva, as well as people to work in the fields in a number of disciplines. They're looking for people with nutrition background, obviously doctors, surgeons, anesthesiologists, everything along those lines, and you can find more information on their website, which will be available in our show notes. All of the people they hire bring their professional abilities, practical experiences, as well as commitment to and concern for the people they help, not just with treatment, but also in sort of bringing global awareness to the issues at hand. MSF is currently interested in receiving applications from medical staff, and this is MSF UK specifically, who would be willing to work in Ebola response projects in West Africa. So just a little snippet, if you meet the general MSF requirements, again, you'll find the link to make sure that you fulfill the requirements as an applicant. But if you meet those requirements for the position you're applying for and have significant recent clinical experience in infectious diseases and are available to spend 4 to 6 weeks in the field, please apply online and mention in your motivation letter that you are applying to work within the Ebola response.
Okay, thanks very much.
Chris, just to add to that as well, I saw the MSF announcement, but Partners in Health, who many people will also know, have also started a recruitment campaign started recruiting for health workers who are willing and experienced to work on the Ebola outbreak in West African countries. You can find that by just searching probably Partners in Health and Ebola, or we can add it to the notes.
Yeah, we'll try and find a link to that and stick it in the show notes. So if you're interested, follow the show notes. We'll get that to you. Okay, now, what we're going to do at this point is we're going to carry on and we're going to respond to questions that may have come from the audience, and we'll have a little bit of discussion and back and forth. But we're going to say goodbye to the people that are watching this on YouTube at some point in the future. So the YouTube component of this is going to end right about now. I just want to say thanks for watching. Remember, you can make comments below. Please subscribe to this channel if you haven't already. I'm going to just quickly tell you how to find things on the channel page. If this is the channel page that you're looking at the moment, and if you don't know how to navigate the page, if you just scroll down, you can see the different videos that we've got here, but you can go to the playlists, and on the playlist you could choose a playlist. Like, for example, we've got a playlist called Epidemiology, and there you will see we've got research, cohort studies, randomized control sites, sensitivity, etc., etc. So that's just how you use the channel. If you go into playlists, we've got interviews with experts, we've got global health ethics, what have we got here? Ethical framework, right and wrong, blah, blah, blah. Anyway, I won't go into this too much, but I just wanted to alert you to those. Thanks for watching. If you're watching this live, stay with us. If you're watching this on YouTube, stay well, don't ever change, don't do drugs, always do your best, and we will see you next time. Goodbye. All right, for those of you that are still here,